This is the Plastic Surgery Channel. I'm John Hammerly, and now we put on the eerie music when we're looking into the future, because that's what I want you guys to do. Plastic surgery, I'll start out 10 years from now. How is it going to look different? How is the face of plastic surgery going to look different?
I think what's so interesting is that plastic surgery is no longer a hidden secret, and that's only becoming more and more apparent. You know, we're seeing celebrities like Marc Jacobs post about his full facelift. We're seeing people talking about extended body lifts, circumferential body lifts. So I think in the future, people aren't going to be afraid to not only undergo procedures and do what they really need, but they're also not going to be afraid to talk about it. And it may be looked at as something like the way we look at maintaining our bodies at the gym. They may say, hey, this is how I'm maintaining myself from an earlier age.
Yeah, I agree. I think to that point, I think the two tenets are start earlier and less is more.
Right.
Right. You know, I always tell my patients this isn't Beverly Hills in 1984 where you come in and you come looking like you were shot out of a cannon.
Right.
You know, people talk about Jennifer Aniston, how natural she looks. And we all know she's been doing phenomenal maintenance for 20 years, but she started early and less is more.
Right. How about technology? Where do you think, you know, if you're going to watch this 10 years from now and go, my God, why didn't I see this coming? What is this? Is it laser? Is it a new device?
I think it's the devices that are harnessing energy, right? Radio frequency energy, for example, ultrasound therapy energy. It's been around for decades. We're just getting better at harnessing it.
Yeah, the target isn't changing. People want something that is non-surgical, no incisions, you know, and tighten my skin, and you know, let's reduce the wrinkles, decrease the fat. The whole idea is just getting the technology better, making it more efficient, making it an easier procedure for the patients. They're not coming back 4 or 5 times for their laser hair or, you know, for other treatments. They're just coming in and, you know, knocking out in 1 or 2 sessions.
If you had the power to invent a device that could do something that you have to do surgically right now, what would it be?
Well, probably something to tighten the skin for like a facelift, and we're getting pretty darn close at that.
Yeah.
I think skin tightening for breast lifts, you know, a non-surgical breast lift or a no cutting breast lift. But we're there. We're trying. We're getting better at it. It's just not quite there. So I think
I'm thinking a little further down. How about thigh lift? You know, that some of these procedures where you're like something that can really work in areas, you know, for most patients. The heavy thighs, the skin above the knee, those are hard places to target.
Yeah, bigger engines without traditional cutting surgery.
Yep.
Thanks, guys.
Thank
Appreciate
you.
it. We're in the present, and if you want more questions answered about the present day or 10, 20 years from now, the experts are here. ThePlasticSurgeryChannel.com.